I think this graphic is outdated because it says 900 consultants, but we've been growing like crazy. So I think it's over 1,000 now. Maybe they'll update it. The 30 plus offices is also true. So headquartered in San Francisco, we have labs all over the US. I'm currently in Maryland between Baltimore and DC. I'm actually in the office today. Had to ask permission, but got in here. We also have offices in Shanghai, Hong Kong, and Singapore, a few in the European Union and UK. So this is really helpful for having people, scientists, engineers on the ground all over the world that can readily vet new suppliers and perform testing. And right now it's really nice because we have different levels of business restriction on our laboratories. So San Francisco is pretty locked down, but our Bowie, Maryland office is a little bit less so. So I have the ability to get into lab, which I have been doing today. So we're a global company, and that's quite helpful with today's markets and the turbulence we're seeing. The company is mounting a response to COVID-19, as we're all aware. So we're helping in a number of fields where we have sort of changing or evolving guidance from the FDA, CDC, and other government bodies, including local health authorities. So we're quite well positioned to assist with these supply chain disruptions. We'll talk a little bit about the insurance claims and force majeure issues people are seeing. But you can think about us as scientists and engineers on demand that you don't have to permanently hire, that can help you with your manufacturing, distribution, and supply issues, product quality, all of that. So what I'll talk about today is manufacturing line restart, supply chain optimization, a little bit about disinfectants, PPE, and material selection, and then a little bit of return to normal guidance, however long that takes us. So a lot of this will be titled manufacturing, but for those distributors, which I think represent a good chunk of the people on here, I think this still applies. Though maybe you're not making the products, you still have processes in place where there's some risk and disruption from the supply chain being shut down in places, to shipping delays, to contracts being unfulfilled, and all of that. So all of these things are available on the website, exponent.com. As soon as you log into that, there's a drop down that shows up with the COVID-19 response. And there's a lot of articles on there that you may find interesting about supply chain and, health. There's a webinar tomorrow at 10 a.m. that, I actually forget the time zone now, I believe it's West Coast time, about monitoring workforce health using technology. So for those of you with lots of employees returning to work, that may be important. So I'll run through this. Please interject with questions at any time. This will be fairly vague, but if you want more details, we can get into that. So our sort of acronym for restarting manufacturing, or any sort of process where we're getting stuff out the door, we're going to use SQUARE. So we have 6 key features we want to keep in mind. Is standard operating procedures, especially in light of staff turnover, that if you weren't able to keep the same employees on or take advantage of the payroll protection program, you have new users. So this downtime may be a good place to get your SOPs in order. So new employees or returning employees can quickly implement those and get your process back to the efficiency you want, or better would be nice. And quality assurance at this time would be especially important if you have had your suppliers change materials, or you're manufacturing with new materials due to lack of availability, or expired stock you have to get rid of. Any of those things, you really want to make sure these quality assurance practices are working well. So that includes having your QA staff and line operators or employees on the floor being familiar with one another, and the processes, especially since some of them may be new. Users of manufacturing lines or any key equipment you're using in your business, whether it's packaging or any sort of stuff like that, have those key personnel changed if there's a loss of institutional knowledge that can really set you back. So coming up with a way to have your senior employees transfer that knowledge between experienced operators and new staff with shadowing direct communication, that's something that would be especially important as we ramp up and you may be making new hires or using new products or processes. And then all of this is dependent on you regularly auditing these processes and sort of being agile in the way you respond to big changes in business restrictions and materials and any process your business uses to get stuff out the door. Reliability assessment, same sort of idea as the QA, QC. You may need to change the testing you're doing based on the material. There's a lot of homebrewed tests that are great at what they do, but those tests may not be valid for new materials that are changed by your suppliers. So if you do any reliability engineering, that's something to keep in mind. And then I think something that's quite important now is equipment. So this is relevant to every business everywhere. If we're going to sanitize all of our frequently touched equipment, phones, surfaces, machines that people are handling, PPE even, if people are reprocessing that and using it, are we selecting the right sanitizers? Are we making sure this equipment is functioning the same? And if we've changed materials, that's going to be really important. So as far as supply chain goes, Exponent is excellent at getting you new materials and managing suppliers. If you're buying stuff from Asia, we have people there that frequently vet those suppliers and can do the testing quickly. We pride ourselves on responsiveness and that speed. So if you have to pivot quickly from one supplier to another, but you don't want to sell an inferior product, of course, we can do that testing and be that independent third party that can give you the information you need to make a decision there. Something that is, I think, generating a decent amount of panic from what I've heard, and I'd be interested to hear from the people on the call if that's the case, is insurance claims and force majeure claims as well, where people are unable to fulfill contracts from suppliers and contractors of various types. And from what we've seen, it is not always the case that the failure to fulfill that contract is COVID-19 related. It's not a given that the outbreak has decreased product quality or resulted in product failure. Those things can still be an engineering failure or faulty materials and processes. So if that applies to you, you may want to consider reaching out for some engineering support and seeing, is this faulty product really caused by the outbreak and lack of staffing or inavailability of materials, or is it something else? So what's the root cause of that? And how can we figure out if this claim is, if damages are awarded to one party or another? So that's cropping up quite quickly, and I suspect will continue for a while as various areas of the world experience different severities of outbreak. Something else I think we'll probably see, given the guidance on disinfectant use, is there's a lot of different types. I recommend, there's links in this document that I'll give to Tara that you can click on, but they're also in the toolkit that the Puyallup Sumner Chamber has on their website. The EPA registered list of approved disinfectants for SARS-CoV-2, the virus of popularity at the moment. So there's different classes. In this picture, we have a few here where you have oxidizers like bleach and peroxide, alcohols, surfactants, And if we're wiping down our products or surfaces at work that are frequently used or anything else, if you're in a retail business of some kind, wiping down the surfaces, you may see degradation or damage to those. It's not to say you shouldn't be sanitizing them, but if you see those problems, can you quickly pivot to another type of disinfectant to try to avoid that? Are your employees being safe when they're using some of these stronger disinfectants? Are they being trained to use it properly so you're avoiding injury, especially with buying commercially available bleach and smearing that on stuff that may give you some product quality issues down the line, whether it's corrosion or hazing or something like that. And then employee PPE, there's a good guide in the toolkit and plenty of guidance from the CDC and FDA on that. So making sure employees have the recommended PPE is important. There's an emergency use authorization. So looking up what you can use alternatively besides the normally required PPE, and making sure your employees are getting the training to use it. If you have a beard and you put on a silicone half mask, it is absolutely not going to work. So you need to be sure that that the proper procedures are occurring. So these teal links here are clickable in the presentation. I'll share it with Tara, but you can see recommendations from various areas. And then there's a little more detail in the back to work section of the Puyallup Sumner Chamber website, which is great. And then finally, return to normal. This is probably the most difficult or temporary thing where the timeline of this is difficult to predict, but at some point we'll need to return to normal as far as alternative or reprocessed PPE. If you guys have masks that you're sterilizing, that's approved now, but in the future may not be. If you're taking measures and it affects your ability to do business, we can help assess the effectiveness of those solutions after the fact and make sure everything was done properly for, say, a potential next round of this. Also product quality, making sure everything stays at the level you want it under staff changes, material supplier changes, delays, and all of that. And then I think quite possibly the most useful of this will be the use of technology to monitor your workforce's health and safety. There's a webinar tomorrow. You can click and look at that. That'll be given by some of our West Coast people from San Francisco. And they'll be talking about mitigating the risk in the workplace, early detection of sick employees, and really trying to avoid getting a business shut down by having an outbreak in your facility. So that's it in a nutshell. I have some references and further reading, so I'll send that. But I would love to have some questions, and I think most importantly, as business people, what gives you the most heartburn about opening, besides when is it going to take place? What worries you have about how to get back into the workplace safely or make sure your products are as good as they were or better, and how you can quickly pivot in the face of these changing government restrictions. So I'll open it up. Whoever wants to hop in, that would be great.
Hey Ben, Cameron here. Hey, first off, thank you. Appreciate all the good information. At McKesson, we're I guess vital to the community. We really didn't have the option of shutting down. But I guess one of the things, or a question for you, we're trying to follow CDC guidelines, and that's the only guidelines that we're following. One of the frustrations for me as a business leader is that it changes so rapidly. 1 minute masks are not recommended, and then the next minute masks are recommended. That's been a little bit frustrating. I'm not sure if there's other people on the phone that didn't shut down during this thing, but curious if anybody else has that similar, I guess, question or concern.
Yeah, this is John from Toy Smith. We shut down a good portion of our operations, only keeping what we deemed as essential open. We have the same issues that the guidelines for employers seem to be changing so rapidly. It's very difficult for us as an executive team to decide which is the prevalent guidance that we should follow. So we're bouncing back and forth between the CDC and the King County Department of Health. But would love further guidance if it's out there on how to combat sometimes even conflicting information to keep our employees safe.
Yeah, so I have heard that from many people. And unfortunately, I think that's an effect of this being such a new virus that we don't fully understand yet the effects, certainly don't understand the long-term effects. There's questions of how it was spread in the beginning. Now it appears to be the coughing and sneezing aerosols, but for a while it was, there's a heavy focus on surfaces, and there still is a little bit, but there seems to be a change in the way they're doing that. So it is hard to keep up with that stuff. And unfortunately, I think that's just as the research develops, that's going to change. At some point, it will taper off. So, you can use an abundance of caution. I think, obviously, the CDC and the county health departments are a good way to go. And I don't have an easy solution for that headache of, okay, now we have to wear masks all the time. All of our offices, I have my mask handy. All of our offices are mask only right now. So not right now, I'm in my office, but out in the hall. So yeah, that is really tough. We can certainly help with that and designing a good system. I think that the best thing is just stay sort of agile about how you deal with that PPE. And it's not as bad as it was, but keeping it available in case there's further restrictions on, or requirements to wear N95 masks or otherwise. Trying to keep a good supply of those can be really tough. That's probably a good way to go.
And this is John from Toy Smith. And again, thank you for your presentation today. Also wondering on inanimate objects, things that we have to use in the warehouse, like something as simple as cardboard boxes, which we plow through a ton of when we're going to reopen and get back to normal operations. How do you disinfect something like that absorbs disinfectant and can actually stain the box and be an issue for our customers if we ship it out? We're using precautions like gloves and where we can, and obviously masks. But any further tips on things like that? I mean, hard surfaces are easy. Pliable surfaces or shipping and packaging materials can be a bit more difficult. Thoughts on that? Sure.
So on the EPA website, it's called List N. They have the registered disinfectants for SARS-CoV-2. They will also specify the type of surface for porous and non-porous. And so really pay attention to that when you're selecting a disinfectant. If a bottle of, or a canister of wipes that you may be using says for hard surfaces such as, marble, glass, steel, probably not the best then for cardboard and those packaging materials that are porous, your foam wraps or anything like that. So overall, the good news is it doesn't appear that on dry surfaces the virus lives very long. That's not an official recommendation by me, but the risk is relatively low there from a gloved, masked employee transferring it to one of those surfaces and having it live. If they're sneezing on the box, that's a separate issue. Several issues really, but look at the type of surface the disinfectant is listed for, and if it lists porous surfaces, that's a better way to go for that. And you may have to do some qualitative testing really quick. If you put bleach on your cardboard box, it's probably going to have some defects there. You may be able to get away with an isopropanol wipe or something like that, but depending on your actual packaging, you would have to evaluate that. We can help, but I think that's something you probably do quickly and do that a little easily on your own. Does that help?
Yes, thank you. And again, very limited application where we'd actually need to sanitize a stack of boxes. It'd only be if we had a suspected, positive COVID issue happen at work. But those are some of the struggles that we're thinking of on the one-offs of how we plan when we reopen and we're bringing back more employees, how we deal with this. So thank you.
Hi, good morning. This is Tranco from Martinborough. So, quick question. As a global supplier, so we supply McDonald's, the entire Northwest region. One of the things, kind of going into the PPE question, is as we deliver into different states, even do pickups in Canada. Is there a tracker or somewhere that gives all the stipulations as to locales, what their recommendations or directives are as far as PPE? Like King County just came out with the directive of wearing masks, even for food delivery. How does that apply, Pierce County, or as we deliver in Oregon and Northern California and Idaho and things like that? Is there a tracker or anything like that that helps guide as far as PPE requirements and directives?
I'm not aware of such a tool. I think that would be helpful, but incredibly difficult to implement with the near constant changes, especially at a local level. If you're going from, a county in Oregon to Washington to Canada, that could be very difficult. So our company, having offices all over the US, Europe, and China, has just gone stricter and gone with usually the most stringent requirements. So I guess technically right now I'm breaking the rule, but I have my mask when I go in the hallway. Every office has masks. We're lucky we have labs, so we have a giant supply of gloves, so we can be careful about how we, handle doorknobs and frequently touch surfaces. But I'm not aware of a tool. I would be wary if a tool existed if it could keep up with the constant changes. So I think the best way is to play it safe, and masks are not fun to wear all day, but that may be, masks and gloves may be the best way to go with frequent changes of those gloves and the typical recommended procedures to keep those clean. So sorry that couldn't be a little better, but yeah.
No, I appreciate it. Thank you.
So I have a question. You talked about how your international company, you're going with most stringent. We hear a lot of what's happening here locally, King County, some local states, but what are we seeing in Europe and China or Asia or just across the United States? What are some of the different approaches?
Sure. So we're seeing the Chinese offices are loosening restrictions. And so I believe a lot of them are back in the office. They are wearing masks. That's our company's policy. I don't know what the local rule is. I assume masks are still required or heavily suggested. As far as European Union goes, we've seen now Germany start to relax their restrictions on some industries, which includes our scientific consulting businesses. but they've had an uptick in cases, so that may come back with more stringent restrictions. So it's really dynamic right now, and I don't have a sense of how the rest of the world is relaxing, but the places that were hit earlier are, through that curve of the first peak in cases, and they appear to be loosening their business restrictions a little bit. Whether or not those will return remains to be seen.
And I mean, because you have this view into different approaches, which we appreciate. So many times we only get to see what's happening through one lens. Who do you, totally your own personal opinion here, who do you think's, for lack of a better phrase, getting it right or doing it best?
So my opinion is I don't really know.
Okay.
I'm a chemist. I don't know if anyone really knows. I mean, so safer is better, but compliance is always an issue. Like getting the public to wear a half mask respirator all day is just never going to happen. They're incredibly uncomfortable. They take training. You got to shave every day. It's just feasible. So, that stuff is, this is pretty new. There's lots of talk in the media of common sense, and I don't think there's such thing as managing a global pandemic with common sense. It's a science-based policy. As we learn, we'll get better. But, I don't know. I don't have a good answer for that.
Yeah, I appreciate the insights. Thank you.
Councilwoman Pam Roach, I believe, has a question.
So a couple questions. Elevators. So before we really did the shutdown, there were elevators, still are in Pierce County. We have 10 floors of our county building. And I asked several times if we could spray them down. It got to the point where I said, can we just spray them down once an hour? And if you go in the elevator and there are more than 2 people, can you face the wall? I mean, I couldn't believe that no one cared. They just wiped them down in the evening and then wiped them down again in the morning, like who's using them during the night? Didn't make much sense to me. What's your thought on the cleanliness in elevators?
Sure. So I think that falls into the frequently touched surfaces. So you have handrails and certainly the buttons, right? So any of those surfaces that people may cough into their hand and then touch, anything like that, certainly sanitizing those surfaces makes sense. As far as frequency, I think there's a recommendation in the toolkit on the website about how frequently, every couple hours. But, with an elevator, if everyone in the morning gets to work, hops in it together, faces the wall, cleaning that after the morning rush and then, maybe lunch or evening, something like that. Just being aware of the scheduling.
That's really not getting it for me. You have all these people. This is a courtroom. You've got everything coming in to the elevators. Some people are sick because they're sick. Just the masses. This is not like an office building. It's more than that. Don't you think they should spray the air with Lysol once an hour at least? I mean, you're talking about surfaces. You're not talking about droplets in the air here. My issue with the elevators is the droplets in the air and the surfaces. But I mean, you can't, you gotta take more than one breath going to the 10th floor. That's my point.
It's fair. You probably can't hold your breath the whole time. Limiting occupancy and having masks is probably the good way to go. I think you would run into some issues with keeping the air filled with disinfectants because you'll have people in there frequently, employees going up and down. If they're breathing that in constantly, that's not necessarily what we want.
Well, you leave the door open until it clears out. There are 4 elevators. I'm just saying the worst situation is having 5 people, maybe an average of 3, 4, I don't know, going up and down all day long and not cleaning the air. That's my thought.
Yeah, I think keeping it clean by limiting occupancy. Great time to hire the old school elevator man in there working the buttons. Making sure people are wearing masks in there. That's hard to get compliance, especially probably in.
Why not face the wall? Anyway, I don't know. I just was never satisfied. The county really didn't do anything but wipe down a couple times a day. And that was before we had this big shutdown. So on another basis here, I work with our ag community. We have some agriculture in Pierce County. And right now they are really worried about being able to get PPE. Can you tell us, and we're busy calling USDA and different groups, but you have a handle, you got to look at the world. How can my community get their hands on some of this stuff?
That is the challenge. A lot of suppliers are restricting to medical use. So if you go to McMaster Carr, where I buy a lot of my PPE stuff, I can't buy it unless I have, I'm a medical facility of some type, and then those people can get it. I think you've got to go through those government channels and try to get access. USDA is probably good. It can be really tough. That's one of the biggest complaints right now is availability of PPE, and we're just using it at a rate that we haven't been for a long time. So it's been hard for manufacturers to catch up.
Food chain. We're talking about a food chain here. There should be some sort of a priority for this. We have a local market where they take food into either food banks or local markets as best they can, or we ship things out because there are some things that we produce in enough quantity that happens. And, we're still planting and things right now, but they are desperate for this stuff. It seems to me, since we are talking about supply chain, we ought to be talking about what do we do for ag and how we're going to get them ready, because it's their number one issue right now.
Yeah, we've heard quite a bit of PPE, and the other for food processing and packaging is the virtually overnight shift in, restaurants are essentially not functioning in the whole US or at limited capacity. And so when they buy things, they buy them in commercial packaging, not individually wrapped sticks of butter from Safeway. I had to make sure to not use a Maryland line of grocery stores, but I got Safeway, that works.
Pretty sure that there's Safeway out here.
Yeah, I just built a new one by my parents' house. But so there's this sort of scramble we have these lines that are packaging these food materials, dairy, whatever, that's making the news more, but other foods. And so, how do we quickly get those packaged for consumer use? Because those things are going out of stock in some areas in grocery stores because people are buying them all of a sudden. So that shift from, consumer packaging to commercial, that's probably secondary to the health and safety of the employees. That's another big one that is tough, and it takes a little bit of time. And unfortunately, this hits pretty quickly. So I think, you may have some traction with large international companies that package food, that maybe they have a line on where they're getting PPE because they probably have a greater ability to purchase it. But yeah, that's a really tough problem.
Before I ask my question, for those that jumped on the line or weren't early on the line, Ben does have ties to Puyallup and Sumner, grew up in Puyallup, and had his very first job as a sandwich artist at the Shell Station Subway in Sumner. So from there to PhD at Johns Hopkins and scientist. So that's pretty impressive. My question would be, for those that engage your services, what does that sort of life cycle look like of working with someone? Timeline, I don't know if monetary is just tailored to, the extent that they utilize services. But for those that might, want to consider having a consultant come in and assist with any of this, what does that look like?
Sure. So I work in a very specific field, but if you email or call me pretty much any time of day, time has no meaning during the lockdown. I'm home all day. I can get you in touch with the right consultant in the right field, and then we'll discuss your problem, see what we can do. We'll usually generate a retention letter that just defines the agreement. We bill hourly, so that's the cost, but we're sensitive to the market right now. So we know that's always tough, but so we can come up with an agreement of how we can best help you, and then we'll go from there. Pride ourselves on speed and responsiveness, so we're always available, and having employees in different time zones really helps get these issues tackled pretty quickly.
Mhm. I would be kind of curious from some of the supply chain management businesses that are on the phone right now, just what kind of just a little overview of what types of practices you are engaged in right now. Although I know it's changing, we're constantly, as a chamber, constantly messaging out who's doing what, and just would like to hear from you firsthand.
I know for me, you know, we're really focused on the health and well-being of our employees, first and foremost. We're making sure, you know, just like Ben, if you come in the office, you know, you got your some sort of face covering on that's limiting, you know, the particles going into the air. You know, we've implemented policies, mandatory, you know, check your temperature before you come to work. If it's, you know, the CDC has said if it's over 100.4, stay home. We've given employees an additional 80 hours of sick time. We're encouraging them, please do not come into the facility if you don't feel well. It's not worth it. You know, we're wiping down high touch surfaces all day long. I've hired an additional, you know, 2 janitors, and all they do all day long is wipe down surfaces, anything high touch. Where there used to be 4 seats at a break room table, now there's 1. You know, we've staggered our shift start time so that there's not people congregating next to a time clock. We're anything we can do. It's evolving so quickly. Anything we can do just keep our employees safe is what we're doing. We're looking at all sorts of different technology, you know, whether it be, you know, air purification or UV lighting or electrostatic disinfection, all that kind of stuff. So just about every office has got a thing of Clorox wipes in it, you know, so anyways, just some stuff that we're doing here because we can't shut down, you know, if we don't distribute pharmaceuticals to hospitals and other things, then, you know, this thing gets much worse. So
Great. Thanks for sharing that. Anyone else?
Yeah, sure, I can go. So for Martin Brower, what we do is we have an on-site nurse where we do the temperature testing here on site, going through the screening questions, if you've been in contact, yada, yada, yada. If anyone answers yes or has a temperature, they are sent home. We quarantine for the 14 days to make sure that they have enough time away, just in case. We start the contact tracing for any issues. We hand out hand sanitizer to every employee. Every employee has access to bottles. We refill them as needed. We hired additional cleaning folks who come in to wipe down all high touch point areas. We have done sanitizing fog of offices and larger areas. We wipe down all our tractor cabs on a daily basis once they return from every route. And just like most people, we encourage people to stay home if they're sick, don't come in. But you know, one of the big things that we saw with the warmer weather over the weekend, you know, people were coming in with a higher temperature because they were in their hot car. So we've instituted measures to say, all right, we're going to retest your temperature within 10 minutes after you had time to cool down. Same difference with break rooms. We try to social distance as much as possible. So there's limited seating in the break room, limited seating outside in the smoke area. We try to maintain social distance with all our inbound carriers. Our our receiving clerks all wear masks and gloves when they're transferring paperwork. We actually spray on the paperwork before it comes in the building, and we let it dry out. And that's generally what we do here.
Wow, great practices. I'll mention real quick with both McKesson and Martin Brower, the teleconference tomorrow, our 3 p.m. teleconference that we put on every week is the panel will be phase oneers. So we have Sean Broback of Crockett's, Kurt Jimistat from Absher, we have Brian Reynolds from Anthem, we have Kyle Hartke from Lawn Care, we have Paul Green from Linden Golf. I would love to have one of you talking about your practices in either of your space. If either of you are available, I'd love to include you on that panel.
Yeah, definitely.
Okay, I'll follow up with some information. And both of you is fine too, but I think that's great.
I apologize, Tara, I would, but tomorrow is pretty stacked for me. I apologize.
No worries. Looks like we got a taker, Martin Brower. Love to learn more about the work you're doing anyway, so that's great. Chris Eiler, I see that you've joined us with the U.S. Chamber of Commerce. I so appreciate you being here as well. Do you, as far as the U.S. Chamber, what types of channels or resources have you been putting out on with this specific, I guess, targeted audience, supply chain management?
Right now, what we're really doing is kind of tracking what each state is doing as far as putting out guidance. We haven't put out anything specific on supply chain issues. It is a fairly big concern for our members, and we are tracking it. But like I said, right now we're really more focused on what guidance each state is handing down. And as I think like a lot of the speakers indicated, there's a lot of variability between the states, and it is leading to a lot of frustration on how, especially businesses that operate in multiple states, how they comply with all the different standards for the PPE, testing of employees, testing of customers come in and whatnot. So I expect at some point we'll have more information to put out on this. We are urging the federal government and states to work more collaboratively to come up with more consistent in these guidelines so there's more predictability. But right now we don't have any like specific products that we're putting out on this issue.
I see that Ben has listed to the group on chat. You might want to grab this now because I don't know what happens once this Zoom goes away. There is the webinar he spoke of. Ben, do you want to mention that again, what the topic is for tomorrow?
Sure. So this is a technological approach to monitoring the workforce. So in terms of health and what current technologies, it sounds like you guys are well aware of what's available and you're using some of it, but sort of risk mitigation in the workplace and how you can keep your employees safe in an essential business and keep that running. So 10 a.m. Pacific time, looks like an hour webinar. Should be hopefully pretty useful for you.
Great. Thank you. I also enclosed his email address. He opened it up to you any time of day or night. Call him with your questions or concerns. Any other questions from the group?
Not a question, I guess a comment. You know, as some of you are thinking about opening up your businesses, I think as Ben pointed out that it's extremely important to have an SOP and enforce it. You know, it's not enough just to communicate something. You have to go, I call it inspect what you expect. And if people aren't following the social distancing guidelines that you put in place, you really should enforce it. You know, going back to the elevator thing, you know, there should be an SOP for the elevator. Hey, no more than 2 people in the elevator at a time. And that's just the policy.
Yep. I think kind of that compliance piece you're speaking of is also now where employers are looking to groups like you to really make sure that they're not left to their own self-interpretation of what to do, but turn to the experts because of the liability and exposure also that is starting to creep up and create yet another challenge to this lovely crisis we're in. So, you know, I guess I would just say, you know, it sounds like there's a lot of folks already exercising good practice, but, you know, if you have capacity or resources to engage professionals with that, I think all the more to protect yourself is certainly a worthwhile consideration to make. Representative Chris Gilden, I see you're on the line. I appreciate you joining us. Did you have anything to add? I know you're making great strides with your county sort of advocacy, the county by county opening.
Yeah, no, thanks. I'm sorry I was late. I was kind of reacting to something. It looks like the governor's taken another track, and we're having some growing pains figuring out how the Employment Security Division is going to assist us with helping constituents with their unemployment claims. So I was working on that this morning. But yeah, we're having some really good progress in that. For those of you that don't know, I've been really advocating a county by county kind of approach to this reopening because, you know, not all counties have been affected the same. I was looking at the data just this morning. We have 30 counties who have fewer than one death per, fewer than one case per 1,000 residents. And, you know, it just seems that we need a little bit of a nuanced approach. I sent a letter to the governor a while back, and he embraced it. And he's allowing 10 counties right now to request for a variance to the 4-phase model. So far, 9 of the 10 have applied for the variance, and 8 of those have been approved, with Kittitas County is still pending decision. And so we'll see how that goes. I think we're going to quickly find some best practices as we move forward, but I appreciate everything that you guys are doing. Thanks.
So any other questions of the group or any remarks, Ben, that you're thinking you might have missed? Or
No, it was good to hear. You know, the information I don't get is from people in the businesses that are still operating or starting to open. You know, I read the news and I get people who have suffered failures and then they call me. So it's nice to hear what people are thinking about now and actually hear what businesses are doing in terms of employee safety and sanitization and all that.
great. Well, again, his contact information is in the chat. I will also follow up with this group with his contact info, the webinar information, in case you weren't able to grab everything. Thank you all for being here. It was interesting to hear your stories. And Ben, appreciate you giving this information to our community. It sounds like I like to be ahead of the game, right? So these types of things help us with our best foot forward. So thank you everybody for joining today.
Thank you.
Thank you.
Thanks again. Great to see you.